Hi, everybody. It's Wellness Wednesday, and in Columbus, Ohio, we are getting a dose of spring, which is absolutely fabulous. So, welcome to our Wellness Wednesday series. And today, I'm doing the talk on building and sustaining wellness culture in academic settings, key evidence-based strategies that work. I first want to share that culture each strategy for breakfast, lunch, and dinner. And I am so serious about that because we could have the best detailed strategic plans in the whole wide world. But if you don't have a culture that makes healthy lifestyle behaviors the norm, chances are people are not going to do those healthy lifestyle things that you want them to do. The other thing that I think is real important to relate, we have collected so much data that supports perceived wellness culture impacts how people feel emotionally and what they do. This is some data that we have collected through a series of surveys that shows what people believe affect what they do. But again, wellness culture absolutely impacts their healthy lifestyle beliefs and their healthy lifestyle behaviors. We developed a wellness culture scale. It's 10 items. We've published the psychometrics on it. It's valid. It has great internal consistency, reliabilities. If you would be interested in seeing that scale, reach out to me. We have several places using it across the country, including the national VA system. So here's the study that we just published in Nursing Administration Quarterly that supports these relationships. What we found in this particular study, compared to the nurses whose workplaces provided little or no support, those nurses who said they had good wellness support at their institutions were less likely to report a negative impact of COVID-19 on their healthy lifestyle behaviors, including alcohol use, healthy eating, physical activity, and sleep. Well, let's take a look at data we also published in the last Big Ten faculty staff survey. What we found was faculty and staff in our Big Ten colleges really were not meeting the evidence-based recommendations for 5 fruits and veggies a day, sleeping 7 hours a night, or engaging in physical activity at least 150 minutes per week. Students also were not overall engaging in these behaviors. So if our faculty are not walking the talk and actually exhibiting these healthy behaviors, we cannot expect our students to do that as well. That was before COVID. Then put the last 2 years on top of that. And what we've seen all across the country, many people have attempted to cope with COVID by unhealthy behaviors. So alcohol use is up. Unhealthy eating is up. Physical activity by many is down. And what that's going to result in 2, 3, 5 years from now, we're going to see even higher prevalence of chronic disease, diabetes, high blood pressure, and mental health disorders. Well, I'm not kidding you when I say we have a human energy crisis right now. Many people across the United States, including our faculty, staff, and students, are languishing. One of the biggest zappers of the energy is sitting. If we sit 3 hours a day, that increases our cardiac risk by 30%. If we sit 5 hours a day, that's comparable to smoking 1.25 packs of cigarettes a day. Now, I hope all of you just stood up when you heard that research data. If you didn't, we've got to think about why, when we know the evidence, why that doesn't magically translate into behavior change. Most people don't change unless crisis happens or their emotions are raised. Culture, though, absolutely influences what we do and how we feel. But culture change takes a lot of time. When we're trying to change culture, we've got to recognize changing a college, a unit, an organization is a highly emotional process. People start getting jiggy when you try to start changing a culture that's been in place for a long time. Group change requires individual change. So as a leader, I always ask my folks the question, what are you willing to do to change, to help change this culture? No fundamental change takes place without strong leadership. And leaders and faculty have to be willing to change before they expect others to change. The bigger and more drastic the change, the more character building the change is going to be. Does that mean we shouldn't dream big when we're talking about changing culture? Of course not. We just have to recognize the greater the number of people involved, the tougher the change is going to be. Many years ago, I read a fabulous book. It's called The Change Curve Model. And even though the last edition was several years ago, it is worth a read because the concepts still are so relevant to organizational culture change today. We've got to recognize when we try to change culture, there are distinct phases of change. And when you get in to actual implementation and determination, that's the highest risk phases for your culture change effort to go under. But if you're prepared and you know how people are responding to change, you'll be able to overcome barriers to sustainable change. So the first element of changing culture or changing an organization is a big picture dream. You got to get your teams excited about a collective team vision, because we've got to know where we're going, or else we're going to end up somewhere where we don't want to be. So again, I'm not saying written strategic plans with smart goals, outcomes are really important. They are. But they are not more important than getting people excited about the vision that you want to create. So I left sunny Arizona 10 years ago to come to Ohio State in a pioneering role that I actually vetted to our president at that time, Gordon Gee. He bought it because I gave him a lot of the evidence. But when I first came to Ohio State, a lot of units, HR, your plan for health, our health plan, student life, they were all doing good things in wellness, but everybody was siloed, doing their own thing. So what we've worked on that has been so beautiful in terms of this culture change is an alignment where we work together. We target evidence-based interventions to individuals and small groups, to faculty, supervisors, managers, to top leaders, and then the system. But all of those evidence-based interventions need to be implemented within a solid organizational wellness culture that makes healthy behaviors the norm, the standard in the organization. We are also diligent about evidence-based quality improvement, measuring outcomes every single year and using that data to then target colleges and units who are at risk for chronic disease. Implementation tactics of the most successful organizations, they do these things. They foster senior leaders' commitment and engagement. We have a new provost here at Ohio State. And in one of my first meetings with her, she asked, Bern, what else can I do to help you in your chief wellness officer role? And I said, Melissa, you can help communicate the message to all the deans in the university that wellness must be built in their strategic plans. She's already done that. So again, fostering. I work with our wonderful new president, Christina Johnson. She joins me for some fabulous university-wide wellness initiatives. So our faculty, staff, and students, they're able to see the in-depth commitment that our top leaders make. Development of an exciting vision with a comprehensive strategic plan. Engaging your faculty, your supervisors and managers as role models who walk the talk. Translating what we know works, evidence-based interventions into our real life settings to help our students, our faculty, our staff engage in healthy behaviors. Establishing metrics and using that outcome data to improve outcomes. Communication is key. Communicating clearly, frequently, tactics to engage people, creating a culture of wellness that makes healthy behaviors the norm, developing a grassroots wellness champion initiative like we have here in Buckeye Nation. I've got about 600 faculty and staff who work with me and my wellness team to really get wellness into the DNA of the colleges and the units, building a caring and connected community, and then developing policies that support well-being. So again, if you really want to strive to improve population health outcomes in your colleges, in your units, these tactics are critical. Well, when we're starting any new culture change, when I go into an organization, I look for the people with a twinkle in their eye and a fire in their belly. I used so much energy when I was younger trying to convince the laggards, the resistors, to jump on my wellness train. As I matured, I really learned you pull the people who are most excited into that vision first. They'll lead you to other early adopters. When you get those folks on board, your early majority get on board, and your culture really begins to shift. Don't put a lot of your time and energy on the laggards, but do remember, why do most people resist change? It's because they're fearful. So a lot of times you can at least have one conversation with those people to actually say, I see you're resistant of this wellness change effort. Tell me if you fear something about it, if you're concerned about how this is going to adversely affect you. So, some other best practices for building and sustaining a culture of well-being. It's got to be integrated into the strategic plan of the academic unit. Here at Ohio State, it is integrated at the university level's strategic plan, as well as in my college's strategic plan. I appointed 2 wonderful academic program wellness directors. I give them FTE time to work with our faculty to integrate wellness throughout our courses and our curricula. It's great to form a formal wellness committee of leaders, faculty, staff, and students. But to provide those folks with a little FTE for their time, it's critical for the leaders in your organization to create visibility for wellness and put out messaging to encourage faculty, staff, and students to engage in wellness activities. We all need to shorten our meetings. I don't do, rarely, 60-minute meetings anymore. I do 45, 50-minute meetings. So I have at least 10 minutes of recovery time to get up and walk, whatever it is, to do a little stress reduction. And then I think it's critical that this not be optional for students. We have got to integrate this evidence-based skills into their coursework that we know will protect them from mental and physical health issues well into the future. Create, and this is a low-cost strategy, put a call out for wellness champions amongst your faculty, staff, and students, but give them a little time, FTE-wise, to function in that way. Again, at Ohio State, I have 600 of these folks across the university. I've got 20 within my college. When you've got these people in the grassroots, again, really promoting a culture of well-being, shifts really start to happen. We need to be offering a menu of wellness activities and programs, because not everybody is going to be drawn to the same thing. And in our meetings, instead of serving high carbs, We need to be serving healthy snacks and water instead of other types of beverages. Regular appreciation and recognition for people's efforts is so important. And we've got to structure things in the environment that trigger healthy behaviors. Every faculty and staff who comes into my college is offered the option of a standing desk. I have walking treadmills all within my building, an on-site exercise room, because I want to make it easy for my folks to engage. Measure outcomes, as I've mentioned. Take an evidence-based quality improvement approach. And if you're trying to get your leaders to invest more in wellness, give them return on investment and value of investment data. So I'm going to spend the last few minutes just showing you our approach to university-wide wellness. We are serious here at Ohio State. We intend to become the healthiest university on the planet. You can access our strategic plan at my Chief Wellness Officer's site that's listed on the slide. We have 4 wellness goals. I presented those to our Board of Trustees back in 2019, who has approved them. We've got a big wellness team comprised of all of these individuals, all of these units. Leaders from each of these units sit together in a wellness council once a month. We review data. We talk about additional evidence-based programming. We target evidence-based interventions to our individuals, our family, our social networks, our workplace culture and ecosystem, and our policies. And then we measure outcomes. We've got an online wellness portal with wonderful programming and apps for people to use. We've got a huge menu of options and programs for our people to engage in. We have shown through our data, those people who engage more have much better outcomes. So again, engagement is critical for better outcomes. I mentioned our force in the grassroots, 600 faculty and staff that work with me and my wellness team to create cultures of wellness. We get what's called a health productivity index score. It's based on 10 leading health indicators that we track every year on our faculty and staff. I meet with the leaders, the deans of all colleges. I go over their aggregate data. I'm able to tell them, your faculty and staff are doing great on their hemoglobin A1C, on their blood pressure, but you have issues with high stress and depression. So my wellness team is going to work with your college on those issues. We track outcomes We have a scorecard. Monitoring outcomes tells us the impact that we make. Lastly, we've got a bunch of wellness policies that really support good outcomes in our Buckeye family. So to wind up, we're having our third National Summit on Clinician Well-Being here in September. It's going to be a great summit, and I hope to see many of you there. I'm just going to end by saying nothing happens without first a big dream. And when you're changing wellness culture, you've got to remember, dream big, but take one bite of the bundle of carrots at a time. So with that, I'm happy to answer one or two or three questions. I'm looking at the chat right now. I see more comments than questions.
There are a lot of positive comments. It doesn't look like we have anyone who have questions.
There is one question that I'll answer. It says, have you experienced pushback from campus employees with concerns about incentives, penalties, and health insurance issues? We really have not. We always provide people with a carrot, not a stick. If you remember several years ago, it was Penn State who approached wellness using more of a stick than a carrot. And they had a lot of pushback on that. I think if you approach wellness and you let your people know, why are we investing millions of dollars in wellness? Well, we're doing this because we care about our Buckeye family, and we want our family to be happy, healthy, and engaged. People are excited here. People contribute to wellness here. And our outcome data, even through the pandemic, have been much better than national outcome data. So again, is it worth building that culture? Absolutely. It will increase return and value of investment. It more than pays for itself. Thanks, everybody. It was great to see you. Have a terrific week. We look forward to seeing you again next week. Stay well.